deal. Well, first, I want to thank everybody for joining us for today's Learning Cafe. I really appreciate y'all taking the time to come back and join in with us. I think we've got a really excellent presentation today. So my name is Caleb Corwin. I'm a psychologist here at the Center of Excellence for Children in State Custody. And we've been doing these monthly learning cafes for a while, doing them virtually for quite a while now as well. As many of you all know, we're currently recording this session and we'll post it online later. If any of your colleagues want to watch it, it'll be on our website and our YouTube channel. As part of our Learning Cafe, anybody who's participating, we ask that you stay muted during the presentation. And obviously, if you have a question, Dr. Culpepper-Walker will let you know how she wants to handle it, but I believe she's pretty open to you unmuting and asking a question or typing a question into the chat as you have it. But in the meantime, I encourage people to stay muted just to avoid any interruptions from background noise. Everybody who participates today, at the end of our session today, we're going to send out a brief survey. And after you complete that survey, we'll send you a certificate of completion that you can keep for your records, which you can use for continuing education or whatever you need it for. We'll also be here in a moment. Once Dr. Culpepper-Walker gets started, I will drop in the chat a copy of her slides, and I'll do that again later on as well, so that everyone can have a PDF copy of the presentation today as well. All right. Well, so I'm so happy that that she was willing to join us today. Dr. Culpepper-Walker and I were office mates for a while on postdoc up in Baltimore, but she is a licensed psychologist who is currently working up in Baltimore. She is working as providing direct care services to children, adolescents, and their families at the Krieger Institute in Baltimore, Maryland. She provides a wide range of evidence-based therapeutic modalities, including cognitive behavior therapy, dialectical behavior therapy, acceptance and commitment therapy, and family systems approaches. She got her undergraduate psychology degree from Tuskegee University and her master's in applied psychology from the University of South Alabama, and her doctoral degree from the University of Tennessee. Go Vols! I'll say that for her and not for too many other people. And she also completed her one-year pre-doctoral internship at the University of Florida. I won't say anything about that. And then her postdoctoral fellowship at Kennedy Krieger Institute at Johns Hopkins School of Medicine. And in addition to providing therapeutic services, she's an overall great clinician, great speaker. We're very lucky to have her. And she's also very interested in presenting on this topic, which is near and dear to her heart, talking about self-care. So Dr. Culpepper, I'll let you take it away.
Thank you. Hi, everybody. So I'm happy to be here with you guys. University of Tennessee is one of my favorite places, and I definitely call it one of my homes because I was there for a while and learned a lot and made a lot of good memories and learned about self-care a lot while I was in grad school. And so, Caleb, I will say, as far as University of Florida, I always call myself a voluntary Gator. All right, so we still have to put the ball in front. So that's all right. So guys, before we get started with the slides, I know everybody is kind of, wanting to hear a presentation and want to hear some good words. I also like some feedback. And so love discussion. You guys can drop it in the chat. You can unmute. Dr. Corwin is going to help me with the chat, monitoring it. So anything you have to say, please drop it in there. I know we have some direct care providers on the call. Do we also have like case management, social workers, nurse practitioners? Give me some ideas of who we have on the call today.
Yeah, why don't we go ahead and just have everybody type in the chat, introduce yourself, name, where you're working, what your role is. I think that'd be just good to hear. Yeah.
Awesome. Okay. Awesome. So I see we have social workers, psychologists, DCS program coordinator. Yes. So a lot of people that know about stress is what I'm seeing. Yes. Licensed clinical social workers, CASA. I remember the CASA work when I was in Knoxville. Okay, awesome. So while you guys keep chatting, I'm actually going to start sharing the presentation. Let's see here. All right, let's go into presenter mode here. All right. So when we look at all of the different roles that you guys are putting in here, program coordinators, social workers, case managers, therapists, counselors, you guys are all considered encouragers, right? And we'll talk a little bit more about that as we go through. And with being an encourager, right, a lot of things come with that, some great and some not so great. Let's see here. So let's talk about what an encourager is. So this is someone who gives support, guidance, confidence, and hope. Other titles might be cheerleaders, supporters, advocates. And so who are these people that we consider encouragers? Well, of course, I work with children, adolescents, and young adults. So I'm always thinking about the babies, as I call them. And so, of course, parents, family members, teachers, instructors, coaches, but even as adults, right, we have people that are encouragers. So mentors, employers, and supervisors. And the people on this call, therapists, counselors, social workers, physicians, nurses, and case managers, of course. Self-reflection piece for you. You can drop it in the chat or just kind of hold on to it and think about it. But have you ever thought of yourself as an encourager? Is that one of the titles that you gave yourself? And also, who are the encouragers in your life? So as much as we do, and that's a theme that you will see throughout this talk, as much as we do for other people, we also need to make sure we know where our strength and where our help is coming from as well. So let's talk a little bit about what happens when you're an encourager. All right. So we have these positive things. We impact others and the community. We can feel accomplished and fulfilled. We have a sense of purpose. We receive expressions of gratitude. We're recognized sometimes, right? And hopefully compensated if it's part of our job, right? But then we have this other part. We experience an increase in stress and worry. We experience fatigue. Sometimes we ignore ourselves and our loved ones. We blur boundaries sometimes, and we'll talk about that a little bit more in a few minutes. And so that can lead us to feeling overwhelmed because we're accepting too much responsibility, right? What else would you guys say? What's something else that maybe is missing from here, up here that happens when you're an encourager? Oh, Lisa, I just saw your comment. You think of yourself as an advocate, but you like encourager. I'd like the word encourager too. Anything we're missing? How do you guys feel like you're doing with hobbies and different things that bring you joy when your primary focus is you're encouraging others? Are you taking care of yourself? I see some head nods. No, probably not. We'll talk today about how you can find that balance. So let's talk about why being an encourager, especially in the fields that we're in, right? Why that might be overtaxing. So even prior to the pandemic, we already had a mental health crisis. All right. So in looking at some of this, between 2009, 2012, states collectively cut mental health budgets by nearly $4.3 billion. So for us, that means, right, if we don't have the funding, we don't have the resources. Right. And then when you look at the shortage of mental health providers, so in 2016, the Department of Health and Human Services predicted that we would need an additional 250,000 mental health workers by 2025. What do you guys think happened with that number? You think it's still 250,000? Right. That is not the number anymore, right? Given what we know about rates of anxiety and depression, This number is likely too conservative now. And also, this was a really interesting part. We have 5,733 US areas that are considered mental health professional shortage areas. That means that these are geographical locations where there is less than one mental health professional for every 30,000 residents. So thinking about your caseloads, right? That makes sense. I don't know what you guys' wait list might be like right now for the people that are doing the clinical work, but in my clinic, and Dr. Corin can tell you, we're a clinic of about 30 people, right? Mostly trainees. In my clinic, we have a wait list of about 500 people right now. And so that's a lot of pressure. And then that goes into this next part about diminishing professional boundaries. So because we're feeling pressure to see more clients, to provide more services, to be more impactful in our communities, we're ignoring our own personal needs. How many of us can say that our caseload is probably a lot higher than it was pre-COVID? Probably most of us, right? Okay. Thank you, Lisa. So just a few stats about this mental health crisis. Again, guys, this is pre-COVID. We already know after COVID started, we started to see a lot more of this. But in 2019, about 20% of adults experienced a mental illness. That's about 50 million Americans. Suicidal ideation continues to increase. And these stats are from the Mental Health America organization. And so they put out a report every year with a lot of different facts and a lot of different statistics for us. And so they've been tracking this for a number of years. And what they found is that suicidal ideation has increased every year. The percentage has increased every year since 2011. We know that over 2.5 million youth in the US have severe depression. Over half of the adults with mental illness do not receive treatment. And some of that, right, is because they don't have the resources available to them. And so if you also look here, we're talking about lack of adequate insurance coverage, as well as rates of substance use, not just for our adults, but also for our youth. That's steadily increasing as well. So then 2020 came, and then we had a pandemic, at least the start of one, economic recession, and civil unrest, given a lot of things, happening in our communities. And so for us, right, I'm not sure as providers, encouragers, right, as people in this field, I'm not sure that we understood what type of impact that was going to have on us specifically. But not only were we then holding other people and trying to encourage and advocate for other people, we had our own personal experiences with these exact same things. So it was no longer I'm helping someone else through an experience that I can empathize with, but I don't know directly. Now we were actually going through it directly and trying to empathize and help other people at the same time. And I don't know about you guys, that was tiring. And so let's look at the impact of COVID. We know this, but I like to look at numbers. So of course, there was an increase in mental health illness across populations. Over 500,000 people reported having symptoms of depression and or anxiety just between January to September of 2020. Now, it used to be that in the US, we had 1 in 10 adults that reported symptoms of anxiety or depression. That went up to 4 in 10 adults in 2020. And of course, symptoms reported difficulty sleeping, difficulty eating, increase in substance use, worsening of chronic conditions, and of course, worry and stress. Now, this one was interesting for me, the telehealth. Of course, we do everything virtually now. All right, we are back in our office a little bit more, but given the increase in COVID numbers, we're definitely more telehealth. Well, overall, telehealth therapy services skyrocketed, so growing 302%. And we can do a whole different presentation on the positives and the negatives of being in front of a computer all day. So what did these things mean for providers? Like all of these increases, what are some of the experiences that you guys had because of this? And you can drop it in the chat as we go on. One thing that it meant for us overall is that burnout became even more of a concern. It was already a concern, but it became even more of one. So burnout is work-related and it's an experience. It's not so much a diagnosis, right? It's actually along this continuum. You don't either have it or you don't. You might have different levels of it. And it occurs when we're overwhelmed for longer periods of time without appropriate resources. And so what it's leading to is emotional exhaustion, all right, changes in our mood, lack of motivation, anger, hopelessness, irritability, difficulty thinking, lack of concentration and forgetfulness, sleeping and eating difficulties. And we're talking about at work. So what does that mean for our work performance? When we're having difficulty thinking, our working memory isn't working so well. Our mood isn't the best. Then you move to depersonalization. So that's this altered perception of yourself and your environment. And a lot of people can form a detached, kind of callous or dehumanized attitude towards their clients because they perceive the clients as the source of stress and anxiety. And so this can last for a few days, up to a few years, and it can also lead to other mental health concerns. And now this last part, people would say you don't have to have this part in here, the reduced feeling of personal accomplishment, but we are seeing more and more of that, right? As we're trying to deal with the growing demand during the pandemic. But this reduced feelings of personal accomplishment, just given the demands that we have, sometimes providers feel like they just can't adequately do their job. They experience a decline in professional self-esteem and experience negative self-evaluation of their performance. So now we're emotionally exhausted. We might be upset with the client or the patient, and we don't feel like overall we're being effective or we're doing our job well. Here's some statistics. So pre-COVID, burnout could really range from about 21% to 67%, right? So that's a large range. What we have found from the few studies that have been done so far since COVID has been happening, 78% of psychiatrists report feeling burnt out. 90% of college counseling center staff report burnout. And in one study, they actually surveyed over 20,000 healthcare workers, some physicians, some social workers, nurse practitioners, and they found that 49% of healthcare workers reported burnout, while 43% reported that they suffered from work overload, and 38% reported symptoms of anxiety and depression. So as this paints a picture, right, that we are stretched thin and we're kind of burning the candle at both ends. And so this impact of burnout, right? We have the individual impact. So we have behavioral health concerns, we have anxiety and depression, poor sleep hygiene, substance use, impaired memory, but we also have the impact to the work environment. So poor working performance, absenteeism. So a lot of the research would say that the more you feel burnout, the more you're taking off. And it's not always planned, vacation, like, oh, I'm going to take off in 3 or 4 months. It's abrupt, which is then causing issues for everyone else in the office. All right. And you also have this decreased standard of care for clients. And if burnout wasn't bad enough by itself, sometimes we can have what we call compassion fatigue. So this is a combination of burnout and secondary traumatic stress. So this would be seen a little bit more in our folks who already have a history of trauma or who are listening to traumatic events or traumatic experiences more often. So you still have that burnout, and now with this secondary traumatic stress, you might experience feelings of helplessness, fatigue, disorientation or confusion, frustration, anger, and physical symptoms, even more so like panic symptoms, shortness of breath, headaches, heart palpitations, sleep difficulties, and muscle tension. And I saw this saying, and I wanted to share it with you guys. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water and not get wet. And that's Dr. Rachel Remen, her book, Kitchen Table Wisdom. And she talks a lot about compassion fatigue and different stressors for physicians. So a discussion question I have for us: how have you been touched by the pandemic? So personally, what are some things that have happened for you guys? Loss of loved ones. Yeah, definitely. Loss of time. Yeah. Social isolation. Increase in need to provide services. Definitely. Right. I think the social isolation piece was one that hit our kids really hard. And people didn't understand how the kids could start off so well. But at first, the kids were like, okay, we're just out of school. Like anything to get us out of school, that's fine. Right. But even my kids who had social anxiety, after being in the pandemic for so long, at some point, they're like, I need to see somebody else other than the people that live in my home. Right. So even those kids with social anxiety were starting to feel isolated. Frustration as a parent trying to keep your children safe. And a lot of us, even though we might have had the option of being virtual with our clients, we still had to be in the office, so we were still coming into contact with other people, and so trying to make sure that we didn't take anything home to anybody else. Increase in anxiety. Yes. Loss of control of our environment. Definitely. And so I'll share with you guys, April 2020, I was having some intense stomach pain. And I said, oh, must have been something I ate. Now, this was a pain I had never felt before, but I had decided it was just something I ate. And so it lasted for about 6 hours exactly. And if I had Googled at the time, I would have found a lot of stuff, but I would have also found the answer. But I did not Google because I didn't want to. And so it lasted for about 6 hours. It went away. And I said, okay, I'm going to do some self-care. I'm going to take off for the rest of today and I'll get back to it tomorrow. All right. Thursday. So that was a Wednesday. Thursday came. I did my job Thursday, a little uncomfortable, but I was like, I'm fine. And so Friday comes and here's this intense pain again. Felt just like it felt on Wednesday. And it's now lasting another 6 hours. And I'm like, what is happening here? So finally, my husband says, you know what? You're going to the hospital. And I said, I can't go to the hospital. People with COVID are at the hospital and I don't want COVID. Right. So he said, well, when do you think you're going to address this? I said, let's wait until after the pandemic. Right. Like, I'm sure it's fine. Like, yeah. And so who is this? Dr. Dean that's laughing. Yeah. He laughed at me just like that. Mm-hmm. And he said, nope, you're going. And so went into the hospital, into the emergency room about 2 a.m. And they said, oh, we're going to have to keep you. We need to do emergency surgery. And so it was a gallstone. It got stuck in a bile duct, or, I'm sure the medical people on here understand how dangerous that is. And so, we did the surgery. Everything was fine. I did not get COVID, which was my only goal, was to not have COVID. And my team, because I keep a wellness team, and I'll talk to you guys today about having a wellness team. My acupuncturist, my chiropractor, even my medical, my primary care physician said the same thing. You pretty much worried yourself into this place. I didn't have a history of gallstones. My family doesn't have a history of gallstones. All right. This was new and unexpected. And they said, a lot of times our emotional state, they were like, this, you're a psychologist, right? Like, a lot of times where we are emotionally will have physical consequences. And so since that time, I've been very careful about worrying and this increased anxiety that Judith Miller is talking about in the chat, worrying about things that I cannot control. Right. And haven't had this issue since then. Hopefully won't have it ever again. But we have to be mindful of how much stress we're taking on, because it can have some real consequences for us. And I was able to get over that fear of, if you go to the hospital during COVID, you're bound to get COVID. That did not happen. And so guys, still go to your doctor's appointments and don't try to wait until the end of the pandemic. So I'm going to move us into how do we combat this? So I never just want to leave you guys with a problem and paint this bleak picture and not talk to you about how we can actually address these things. So of course, self-care is one of the ways that we want to go. And so one thing to remember, burnout, compassion fatigue, being stressed and overwhelmed, these are not inevitable things, right? One thing that the pandemic did give us, it took a lot from us, but what it gave us is a chance to take notice of what's important, to slow down when and where it's possible, and in a lot of ways reevaluate, right, what we're doing, what we deem important, what can be an email versus a meeting, right? And so here, self-care is the practice of taking action to preserve or improve one's own health. And it's really important to note that self-care is personal. So I tell people all the time, self-care might look totally different for you than it looks for me. A lot of people will say, and we'll talk about self-care activities, but that's not the only part of self-care. But, people know about, oh, let's do yoga. Let's go get a massage. Let's get our nails done. If you're not a person that likes touch, those things might not be for you, right? That doesn't mean that you're not doing self-care. You're just doing self-care in a way that makes sense for you. And so, of course, there's been a lot of research on self-care. And some of the things that we found is that when you engage in self-care, you have a greater sense of well-being, lower levels of stress and negative affect, higher levels of positive affect, a flourishing self-rated academic and clinical performance. So this would actually combat that part of burnout where you have like low academic or low clinical performance. Compassion satisfaction. And this was a new term for me. So compassion satisfaction is this positive feeling that you get while you're helping others, right? So it's like that sense of fulfillment almost. And then quality of life, which is what we're going for. And that's what we want for our clients as well, right? So self-care definitely helps us in a lot of ways. Guys, while we're going through this, drop in the chat what some of your self-care regimen looks like. Because sometimes it's helpful for people to be able to see what other people are doing. Now, one aspect of self-care that I don't think we give a lot of attention to, and we should, boundary setting, right? So for one, know and respect your limitations. By acknowledging whatever your limits are as a person and as a provider, you can then recognize when other people are overstepping your boundaries. Delegate when appropriate. How many of us have an issue delegating? Yeah, we want to hold on to it ourselves, right? It's like, well, I know if I do it, I'm going to do it correctly. Yes, and someone else might do it totally different, and it could still be just as awesome, if not better. Effectively communicate your boundaries. So sometimes we keep the information to ourselves. We don't share it, so people don't know it. And people will take as much from you as they can. Let's be honest. And it's not, it's not in a way of like, oh, let me see, can I get over on this person? It's more of everybody has a need and everybody's trying to get that need filled, right? And so if you're going to give and give and give, people will continue to accept. Be okay saying no. I didn't realize how difficult this is for a lot of adults until I started trying to do it more myself and be intentional about it. Sometimes we feel guilty when there's absolutely no reason for it. Make sure you check in with yourself. Do you have the capacity to take on one more thing? And if you don't, refill your cup before you fill others' cups. All right. So you have to make sure you can take care of you in order to be able to take care of others. And definitely remember that while your work is valuable, so are you. And those two things are different. See, we have a few things in the chat here. Morning exercise. I try my best to do that because it helps your day, right? It helps you move more. It helps you feel a little loose. And I feel like if I'm flexible physically, I'll be more flexible mentally as well. Daily family time. Yeah. Free from phones. I love it. And Caleb, we're going to talk about what you can do with those phones that are actually helpful because we're usually glued to them, right? So we'll talk a little bit more about that. Okay, especially, yes. Take a short vacation. Yes. And we have a DBT group that we run with teens and their parents. And we talk a lot about, if you can't take that physical vacation, definitely take a mental one. Sometimes just researching the place that you're going to go later, right, can take a little bit of stress off and make you feel better. Now, another part is social support. So you want to connect with other providers, right? Especially when we're in systems like we're in here, you guys can definitely, reach out to other people, consult often, but also engage in professional community groups online. So there are a lot of nice, maybe Facebook groups for clinicians, maybe not so much Instagram, but Facebook, APA, different organizations that provide these online spaces for people to kind of connect. Identify other people with similar circumstances, right? So Dr. Corin and I can talk about, postdoc interviews because we're both going through that at the same time, right? So we can talk about, how many interviews there are, how many times you have to connect with the applicants, right? How you want great people, but you don't always have enough slots for them. That's stressful too. All right. So share your experiences and your emotions and even your obstacles and provide support for others. So sometimes being able to be there for someone else can refill you. It doesn't have to always pull from you. Maintain a network of friends and family and peers who are available to provide support for you when stressors arise. My friends and my family are awesome at this. They don't always understand, right? Like everything that we're going through, but they can tell when it's been a draining day. And they're like, what do you need? All right. So you definitely want some people in your life like that. Participate in community organizations. So again, sometimes we will say things like, I can't do anything extra. I don't have any more time for this, right? I can't afford to do that. But when you think about your care and you think about your health, can you really afford not to do it? Right? So I can't afford to ignore my needs. I can't afford to continue putting everyone else before me. I can't afford to keep pushing without rest and restoration. All right. So some of these things really are more of a need than it is a want. And then speaking of restoration, right? So we have these personal restoration activities. This is the part that people usually know about when we're talking about self-care. These are those things that you do. It's important to note that these activities not only meet basic needs, but they actually bring joy and fulfillment. So you're not just doing something just to do it, right? You're doing something to actually get some type of relief. And so this might be spending time in nature, connecting to a higher power, something greater than yourself, working on passion projects, identifying hobbies outside of work, and also seeking professional help when needed. Right. So going back to the story I told you guys, I needed to go see an actual physician. Right. All the rest in the world was not going to correct what was happening. And sometimes that means, maybe we need a personal trainer. So, Dr. Dean, I try my best to exercise in the mornings, but I need my own kind of accountability person. Right. And so sometimes that means paying for it. So here we're also, of course, talking about therapy, but not just therapy. This could be, any type of professional that could help you with whatever your goal is. So here are some categories and some examples for people that maybe need some. So we have movement activities, Exercise, hiking, yoga, dancing. Mindfulness activities look like coloring, mindful eating, guided imagery, relaxation techniques. So that would be that massage or stretching, muscle relaxation, deep breathing. You could do meditation, praying, daily affirmations. And I'm going to tell you guys about apps, but one of the apps that I discussed, it's a daily affirmation app. Hobbies and interests. So some people have taken up cooking a little bit more since we've been in the pandemic, painting, singing, sewing, gardening, spending time with loved ones. Caleb, I know that's a big one for you. Healthy eating and sleep habits. Those are actually self-care activities. All right. So if you're doing that, you can check that off. And rest. How many of us understood that rest was one of the self-care activities? How many people are actually good with resting? Not so much sleeping, but just resting. Caleb, I saw you almost put your hand up, right? All right. Somebody else did raise their hand. Okay. That's good. I'm still working on that one. Right. Because even when I'm resting, my mind is going. I'm like, what else can I do? What can I do for this patient? What metaphor can I use to help them connect, right, what they're doing with how they're feeling? So my mind is always going. And so I've been working to calm that a little bit. And so hopefully, let's see, you guys are dropping some more. Yes, watch webcam of my favorite beach. Work on a jigsaw puzzle. That's a really good one. And all of those kind of mental games, so like Sudoku, the different puzzles, all of those things can be helpful. Now I put specifically phone apps on here just because of the relationship that we seem to have with our phones, right? So it's usually somewhere nearby or it's in our hand, right? We're always checking it. It's always beeping and buzzing, right? We can actually use our phones, and I tell this to my kids all the time. You can use your phones for good. Right. So when parents say like, oh, I need them to put that phone down and not look at it for a whole day. Well, we could also use it for reminders. All right. We could use it for daily affirmations. We could use it for nice little notes to remind them how awesome they are while they're in school. Like there are different things that we can do with it that's positive. It doesn't have to be a negative thing. So here I've listed a few phone apps, and there are many, many more. But these are some that either I use personally, or I have patients that use them, or friends or colleagues that use them, and they are free. Of course, all of them are going to have in-app purchases. So it's like you can have the basic plan for free, or you can upgrade, for so much a month. But Headspace is an awesome app, and it includes meditations, tension relief workouts, yoga exercises, and relaxing music. Shine is another awesome one. Shine is probably going to be more like the Calm app. But Shine it was also created by people of color, and it was created with people of color in mind. And so for a lot of my African-American teens, I will suggest Shine. So it provides daily customizable self-care skills, meditation, gratitude logs, and mood trackers. The 5-minute journal, that's for our people that are like, hey, I don't have a lot of time. Right. I'm trying to do this self-care thing, but I have probably 5 or 10 minutes to devote to it, at one given time. And so you can do 5-minute self-reflection activities. The Calm app, everybody for the most part knows it and loves it. Meditation, mindful movement, relaxing music, and personal accounts of others. So they have a lot of celebrities who share like what they do and what's their self-care routine. And then you have the 365 gratitude journal. It sends you daily personal gratitude prompts with stories that teach life-changing lessons. And so it gives you a chance, even if you don't have like anything, specific to write about, it gives you a chance to just stop for a moment and reflect. And reflection is needed because first we need to be aware of what's going on for us before we can address it. If you guys have other apps that you use and you love, definitely drop that in the chat. Now, considerations for our workplace, right? Policies and procedures. So I know there are probably some people on here that are in charge or in the room when people are creating policies. And so self-care is something that we also need to think about as we are creating our work environment and our work culture. Right. So one thing that the people in charge of this can do, reach out to staff regularly to give them a space to share their experiences and their concerns. Provide opportunities for trainings, peer support groups, encourage staff to take breaks and connect with their support system outside of work. So this is something that's really big for us in our postdoc program because the trainees are coming in knowing that work-life balance is important. I don't know that we've always known that, right? So they're coming in asking questions about work-life balance. And so that's an area that we have to be able to address. You want to also provide opportunities for staff to make connections with other staff, team building activities, and it's the best we can right now, given where we are, right? So most of this might be virtual, but it can still happen. And also providing materials and resources for self-care. All right, so even though self-care is personal, you can give people ways to kind of start working on it, or at least put the idea in their mind that they should be working on it. All right, guys. And so my last little bit for you before we open it up for questions, be mindful of your feelings and what's going on in your body. And after that, be prepared to address it. Okay. Be gentle with yourself. We already know life can be difficult, but we have to validate how we feel. And we have to also celebrate the wins, no matter how small or large. And be intentional about your self-care. Don't let it be an afterthought. So it's not, I'll take care of myself after I've taken care of everybody else and done everything else. Right? You actually have to put yourself first in order to be the best encourager that you can be. And so I like to give homework. So my take-home assignment for you guys, identify one new boundary setting technique that you can implement. Identify a new social support, or if you already have good social supports, identify a way to strengthen one of your current social supports. And identify one new self-care activity, because we can never have too many. All right. And guys, the rest of this are citations, so you can read through all of these articles with all of the different statistics in it. And a lot of these articles also give you some more ideas about some self-care activities. All right. I am going to stop sharing the screen so we can discuss. Okay, Caleb, I see you dropped the links. Thank you.
Yeah, I was just to say I really appreciate that presentation. I think it's one of those topics that I probably could have, especially early in the pandemic, benefited from like a weekly class and reminder on before it overwhelmed me at some point. But, I think one of the points that you made that was so critical for me is just setting those boundaries, right? That like, how often do I tell somebody else, like, you got to put the mask on yourself before you put it on the other person, or but like over my own head constantly as I'm saying it, that like, you know what, I'm the person, do I have my oxygen mask on?
Right.
Like, did I ever take time to figure out where that was?
Right.
And so I just think it's such an important point to, put ourselves, like, make sure we're putting ourselves into the plan, right? Into that we're part of our self-care is part of the treatment plan for our patients.
Definitely. And when I see a lot of one thing coming in my room, like over and over again into the treatment room, I have to stop and assess myself, right? So why are you seeing this so much? Is it that you're not doing it yourself? So when I have to talk to them about self-care a lot, then I know that there's something there for me to do as well. There's a message in it for me too. Yeah. And Caleb, sometimes I'll know as I'm telling them to put on the mask, I'll know that that's for me as well. Yeah. And I still sometimes we choose. I'll say that. My acupuncturist always says, whatever story you're using in your life, sometimes you choose to go down certain paths that aren't the best for you. When you do that, just be aware and know what you need to do on the other end.
Okay.
Yeah. So sometimes I overbook, right?
Yeah.
and I know that that's what I'm doing, right?
Mhm.
But then I need to know that I need to up my self-care plan for the weekend if I'm going to have a week like that.
Yeah.
Mm.
I also had to like realize my own signs that I'm burning out, right? Like one for me is when I get in this habit of like, please don't show up. Like, please, like I start dreading patients. I'm like, am I taking care of myself? Because I certainly don't seem to be in a position to take care of other people. Like,
Right.
I'm avoiding the thing that I've like decidedly done for my career. And I spent all this time studying, like, am I, doing what I need to do?
Right. And that's one of the points, right, for burnout, right? Like when you lose that joy and this is something that you've been joyful about, right? We went to school to do it. We went through a lot of school to do it for a reason. And so when you're missing that joy, that usually signals that we're doing too much of something.
Yeah.
Yeah. Yeah. So guys, any questions for me? Any comments? You can unmute or drop it in the chat.
This has been great, Dr. Culpepper. Thank you so much.
Of course. Like I was telling Dr. Corin, I love talking about self-care because it's so needed, right? Yeah. And so my hope for our kids, which is why I love to work with kids, my hope for them is that they will learn this earlier than we did. And so they won't have so many years, right, or effort spent trying to get to where we know they could be earlier in life. So
yeah, absolutely.
Yeah. Oh, you're welcome.
Well, I just want to first thank Dr. Culpepper again. I think this is an excellent presentation. I think honestly we could present iterations of this every month and be doing a service to the community. But I really do appreciate you taking the time to give this presentation. I think it's just so needed. I encourage everybody who participated today to take the time to do the survey in the link that's in the chat. There's also a copy of the slides if you want that. I'll also let everybody know that Dr. Culpepper also he kind of keeps this conversation ongoing. She's got some social media, Instagram, Twitter, Facebook. You can follow her. I posted her handle in the chat, so you can kind of follow for ongoing tips and updates along those lines. Also, we will be posting this recording afterwards. We'll post it up to our website as well as our YouTube channel. So if you have coworkers who missed this and might be interested in this conversation, you can share that link with them as well. And then also, I want to let everybody know that next month, we're going to kind of, in many ways, keep this conversation going with Dr. Williams presenting to everybody on February 18th about, is this going to last forever? Rediscovering resilience in a time of COVID. So talking about related topics for sure, everybody. So Dr. Culpepper, thank you so much again.
You are so welcome.
Really, it's great. It's great getting to see you and hear you speak. And this is such a great topic. Thank you so much.
Yes. And thank you guys for having me and letting me visit Rocky Top for a little bit.
Yeah.
Anytime. You're always welcome.
Thank you.